Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals and guidelines within the health sector. In this video, we shall be focusing on Ghana's Community Scorecard guidelines. Launched in 2018, Ghana's Community Scorecard serves as an accountability tool that engages communities in enhancing local health services and provides stakeholders with valuable insights for service delivery improvements. The Community Scorecard involves quarterly scoring sessions where community members vote on 9 service quality indicators and the creation of community health action plans, also known as CHPS, to address identified gaps. Scores and action plans are integrated into Ghana's health information systems, including the DHIS2, as well as the online scorecard platform, featuring color-coded scorecards and an action tracker tool for monitoring plan implementation. The Community Scorecard empowers communities to monitor and enhance health services while providing routine feedback to inform evidence-based actions for health system improvements. Coordinated nationally by the Ghana Health Service, the initiative involves CHPS coordinators at the regional and district levels and is implemented at the community level by the Community Health Management Committees, integral to Ghana's community-based health planning and services. So why integrate the Community Scorecard into the CHPS concept? Developed by stakeholder consensus, the Community Scorecard is seamlessly integrated into the implementation of the CHPS concept and National Primary Health Care Strategy in Ghana. CHPS aims to involve communities actively in delivering essential community-based health services with community health management committees, ensuring community-level guidance and mobilization. The Community Scorecard serves as a pragmatic tool for CHMCs to systematically assess the quality of services provided by community facilities, enhancing their coordination efforts to strengthen the local health system. As outlined in the CHPS policy of 2016, the Community Health Management Committee members, including the community health officers and other healthcare professionals, to utilize the Community Scorecard to conduct quarterly assessment and action planning sessions, promoting more effective community engagement in health system improvement. This user manual provides guidance for community health management facilitators in conducting Community Scorecard scoring and action planning sessions. Community Scorecard indicators. The Community Scorecard indicators are defined and discussed through 5 to 10 minute sessions, followed by voting on a scale of 1 to 3. Indicator 1 focuses on caring, respectful and compassionate care, evaluating person-centered care and effective communication. Indicator 2 assesses waiting time for healthcare services, questioning the perceived duration and justification of the wait. Indicator 3 examines the availability of medicines, diagnostic services and medical supplies, emphasizing whether prescribed medicines are consistently received. Indicator 4 evaluates the availability, accessibility, and affordability of services, considering geographic proximity, cost, and infrastructure adequacy. Indicator 5 scrutinizes the leadership and management of facilities, emphasizing responsiveness to community needs and prompt grievance handling. Indicator 6 addresses the cleanliness and safety of the facility, including hygiene, power supply, and security. Indicators 7 and 8 assess home visit by community health officers or nurses and community health volunteers or workers, focusing on the frequency and satisfaction with these visits. Lastly, Indicator 9 evaluates national health insurance services, considering the National Health Insurance Card acceptance and the patient's ability to access medicines through the National Health Insurance Scheme. Participants actively contribute to these discussions, providing valuable insights into the quality of health services in their community. If you've liked this video so far, give it a thumbs up and subscribe to the official YouTube channel of the Ghana Health Service. Comment down below as well to let us know what you think, and click the card above to view all Policy Visibility Drive videos. Steps for conducting Community Scorecard scoring and action planning sessions. Preparatory Phase. In the Preparatory Phase, which occurs at least 1 week before the assessment, the Community Health Officer informs the Community Health Management Committee about the Community Scorecard process and schedules a meeting date. Sub-district and district leaders are briefed about the assessment details, and the Community Health Management Committee is equipped with the necessary materials, including the scoring forms and action planning documents. A facility tour is conducted to familiarize the Community Health Management Committee with the existing infrastructure and resource availability. During the meeting, the Community Health Management Committee chair or a designated facilitator leads the discussion using the provided guide, with the secretary documenting decisions. A minimum of 15 participants, including at least 50% females and a diverse socioeconomic background, is recommended. Importantly, the facility head should refrain from participation or observation during the scoring session, ensuring community members freely express their feedback. Scoring process. Participants, including the Community Health Management Committee Chair or Facilitator, introduce themselves, and attendance is recorded on the action planning sheets, noting the number of participants as well as the number of females for participants' composition awareness. The Community Health Management Committee Chair then reassures the participants that scoring is solely to gather community feedback on health services, emphasizing the value of honest opinions. Participants choosing not to answer, lacking experience with the health facility, or having other reasons to abstain are considered neutral in the voting process. The facilitator then outlines the objectives of the community scorecard process, which is to understand health service quality, identify priority issues, create action plans, provide regular feedback to government and partners, and enhance accountability and transparency in the health system. Using the score sheet, also known as Form A, participants discuss the 9 indicators reflecting their healthcare experiences. Each indicator receives a score of 1 for bad, 2 for average, and 3 for good. Community members then vote on each indicator, and the score with the majority vote is recorded in Form A. In the case of equal votes, the lower score is recorded unless a consensus is reached. The facilitator summarizes the discussions and ensures all scores are recorded on Form A. Action planning process. Developing community health action plans involves a post-scoring assessment session led by the Community Health Management Committee Chair or Facilitator, with all responses recorded by the Secretary. This session, convened with the facility head, the Community Health Management Committee, community members and interested groups, aims to review the previous action plan, address impending actions, and create new community health action plans for the quarter. The facilitator guides a participatory dialogue between the community and the health service providers to identify priority issues expressed by the community, resulting in a new action plan developed by the Community Health Management Committee using Form B. A minimum of 3 action items, which are to be addressed within the quarter, should be identified, with the community health officer or the facility head guiding but not writing the community's issues and solutions. The Community Health Management Committee Chairperson emphasizes the quarterly recurrence of the community scorecard process and expresses gratitude to the community for their active participation. Final steps. In concluding the quarterly community scorecard process, 3 copies of the scoring sheet, that is Form A, and 3 copies of the action plan sheet, that is Form B, should be created. These copies are distributed to the Community Health Management Committee Chair, the Community Health Officer or the facility head for display on the facility's wall, as well as the District CHPS Coordinator. Subsequently, the Community Health Officer or facility heads enter the data into the DHIS2 or submit the data to the district for entry. Additionally, the action plans are input into the Community Scorecard web platform Action Tracker tool or submitted to the district for web platform entry. The Community Health Officer reminds the community members that scorecards shall be accessible every quarter. Following the quarterly scorecard process, the Ghana Health Services Policy Planning, Monitoring and Evaluation Division is responsible for uploading the scores onto the scorecard web platform within 1 month after the quarter concludes, making the scorecard accessible to users at various levels with an account. Regional and district CHPS coordinators utilize the data and action plans to inform their activities, provided targeted support and intervention as needed based on the information obtained from the scorecard process. Please note, this video only contains an abridged version of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Service website at www.ghs.gov.gh. Thank you for your time and attention.